There has certainly been a lot of misinformation out there about the COVID-19 vaccines.
We got a question from a viewer here in Maine asking if there are pieces of rubber in the vaccine. Let's verify. We got this question from Ann in Waterboro.
The proper technique that you use to give an intramuscular injection, including when you're using a multi-dose vial, replacing the needle that you pulled the medication out of, and the size of the needle that's going into that person's muscle.
Anne clarified, saying she wants to know if pieces of the rubber stopper at the top of the vial are getting shredded by the needle and getting into the vaccine fluid. So that's the claim we're verifying. Our sources are Maine General Health Chief Medical Officer Dr. Steve Diaz and the US CDC. Dr. Diaz says it is possible.
It's probably microscopic. There are, over the last 30, 40, 50 years, as we've used different medicine vials. Originally, the rubber stoppers were latex. Majority now are latex free.
Diaz says doctors have changed the type of needles they use over the years to avoid this phenomenon.
So now they go to very thin, small, sharp needles that don't core and have less chance of pushing microscopic pieces into the fluid. Despite that, there isn't any large problem with this. And I don't say that just based on the COVID vaccination, but multi-use vials in medicine are used worldwide every day.
The CDC says multi-dose vials should be dedicated to a single patient whenever possible. The agency says if multi-dose vials must be used for more than one patient, like they are with the COVID-19 vaccine, they should only be kept and accessed in a dedicated, clean medication preparation area. If the technique being used in the millions of people getting vaccinated across the country was causing any type of adverse reaction, doctors would have reported it to the CDC's VAERS database that tracks those reactions.
This would have been reported as a significant issue if this was something that over and over again caused a local reaction or even more systemic reaction that we've not seen on the outcome data.
So we can verify, yes, it is possible to get microscopic pieces of rubber into the vaccine fluid, but so far, no major adverse reactions have been reported. If there's something you'd like us to verify, just reach out. Email us at verify@newscentermaine.com, or you can connect with us on social media.